Now to this story. The Young Nurses Indaba trade union is demanding an end to budget and staff cuts. They're demanding that nurses hired in the peak of COVID-19 must stay, and they want a response from the Department of Health in 7 days. If they don't get that response, they are threatening to embark on a strike. eNCA reporter Nqobile Madlala was at the march today. She joins us now. Nqobile, thank you very much for chatting to us. What exactly are the workers saying about the issues and how the shortage of staff and funds, how's that affecting their ability to deliver the service of healthcare?
Well, Sally, they're basically saying that there are two parts in this. There are people without work and there are people with work, but they are working and they are strained. So they're saying that they need assistance. If you are in the hospital or in the healthcare facility, you need assistance. They're saying that nurses have been stretched to such an extent that some of the nurses are now doing general work that they're not supposed to be doing. And they're saying that this has effect on the work that they do, the services that they provide, but also it has the effect on the community. Others are saying that they're staying at home. They were given work, they were glorified as heroes during COVID and after in the height of COVID, but after the numbers started dropping, they feel like they were then just discarded and the government never came back to them to say what is the way forward. Now they all want to go back to work. So there's something that's common there. They all want to work together, but they're saying that they feel that they need to have a unified voice to speak to the government, which is mainly why they took to the Treasury and they took to the Health Department to give them the memorandum to say that on those budget cuts, they need to consider the fact that there are people that need to get work so that they can provide the services to the people on the ground, which they believe they deserve so much, under so much stress that people are under at this point. But also they're saying that there needs to be a measure in terms of austerities that they're saying that there needs to be a way, if you're cutting down the budget, you need to also still make up for the services that needs to be provided. So there are quite a number of things. Bring back the nurses, make sure that the nurses are given the job, that they are permanent on the job. But they're saying that also there's an issue with outsourcing. They now want the securities to be insourced so they don't just so that they're not just paid little money, and that the middle person doesn't need to be there because they need the money, because this also impacts on the amount of money that they take back home, which means that that impacts on the food that they bring into their own homes.
So I know that they've given the Department of Health 7 days to respond, but have you managed to get any sort of response at all from the Department of Health today?
Well, at this point, it's a waiting game, really, Sally. From what we heard when Treasury was receiving the memorandum, they said that they will respond in 7 days. So there is a commitment to say that they will respond. But whether or not they will get what they're looking for, that still has to be awaited for. So now, at this point, from what we understand from the union, they're saying that they will have to intensify their voice by also bringing in other unions that will speak at this on the same issue with the same voice, because they're saying that this affects everyone in South Africa who's in the health fraternity, because the people that are working there are giving the services to the communities and they do need the assistance. But I did file a report. Let's listen in. The Young Nurses Indaba trade union represents over 17,000 healthcare workers in different provinces. On Wednesday morning, they delivered a memorandum to the National Treasury and the National Department of Health. The union has accused the government of neglecting public health care, claiming it's because officials are using private health care. The leaders say the officials are not transforming South Africa's healthcare system. They claim nurses are expected to do general work in addition to their nursing work in public healthcare facilities. They say this is contributing to the shortage of staff as general workers are not being hired. The union is demanding an end to austerity measures, the permanent employment of staff, a budget to absorb staff hired during the height of COVID-19 infections.
We are saying the department must increase the budget so that head of institutions will be able to do the work on the ground. That is our first demand. The second demand is that we demand that all COVID-19 contract workers must be absorbed permanently. The system needs them. We are desperate.
We are saying the Premier should hire people and give people permanent position so that we'll be able to serve our country, our community, and give the best health care.
I just want my job back. That's that.
Just imagine 10 lines at the different clinics. Our communities are struggling because we are not there anymore.
It kills our communities because our communities are suffering because the time we were there, they were suffering but lessly so. But right now they are suffering more than ever.
The trade union has given the departments 7 days to respond. Failure to do so, the union says they will be joined by more forces to speak with the same voice. Nqobile Madlala, Pretoria.